Thank you, Mr. President. I rise to give my no vote explanation, and I even changed masks so that people would be able to hear me a little bit more clearly. I believe in experts, and I say that as somebody who went to school and has always been trained to value those who value education and research and training. And so the goal of this legislation is to have an investigation. Do you know who do investigations best? Investigative journalists. And two of them wrote a really expansive article about that, a nonpartisan, impartial document that talks about facts. What do prosecutors do? They prosecute crimes. They go after people who have committed crimes once they have credible evidence, which we've not seen, which we've not heard, which no one has even hinted that they have. And so in today's MLive, Emily Lawler and Julie Mack talk about just this thing. They quote one of our former colleagues, the now current prosecutor from Macomb, someone who we all know and know well and know has never pulled a punch or thought a second twice about his words. And when asked about his evidence, he said, he doesn't know. He doesn't have any, but rather a culmination of general information he'd like law enforcement to look into. Now, I've never heard Pete Lucido make a statement so guarded, to say something so abstruse. I mean, the Pete Lucido I served with would tell you something that was always more colorful, always more clear. And so when he's dancing around an issue, it's probably not much there. But, you know, I just think that's a waste of money. I think it's a waste of our time, it's a waste of our resources. But let's talk about what the investigative journals found out. They said, and I quote, "On two different metrics, Michigan is slightly below the national average in regards to nursing home deaths. The death toll per 1,000 nursing home residents and the percentage of total COVID-19 deaths attributed to long-term care facilities. On the latter, about 31% of the state's COVID-19 deaths are attributed to long-term care facilities, compared to a national average of 34%, which makes us 3% low." Now, no one is saying that Michigan did a bang-up job. No one is saying that anybody did. COVID-19 was terrible, is terrible. It hurt people. We lost people. We should be spending all our time trying to make sure we lose less people, not going back and saying, well, did someone try and think about this thing incorrectly, when we all know that everyone was trying to do the best that they could. People made mistakes. But that's not what this is about. And I quoting again from the article, "In focusing on that policy, Republicans are ignoring the outsized role played by transmission rates in the communities where the nursing homes were located. Say those who have studied the outbreak data. Experts say the big problem has not been patient transfers, but asymptomatic and pre-symptomatic transmission by nursing home staff who come in and out of the facilities each day." How do we stop asymptomatic spread? Simple. The CDC says, wear a mask, social distance. And yet, earlier this week, members of this body were out hanging out with someone who openly thwarted every attempt to do that, to cut community spread, to mitigate all these things in favor of more political moments, more opportunities to fight for the little guy. Let's fight for the people who we've lost. Let's make sure we lose less of them, and let's come together around these issues. Now, one of my good friends, the senator from the 38th district, in talking about this thing said, there were mistakes made, but in good faith, which doesn't sound like the basis for a criminal investigation. It sounds like the basis for us to come together and say, hey, what are the policy changes that we need to make going forward? And I know a number of the members in this chamber, both on the Republican and Democratic side, are interested in doing those things. We've had those conversations. We've talked about changes to how we deal with these things and funding them. That's the money we should be talking about allocating. Those are the funds that we should be spending these on, is getting more dollars into these local communities so that they can deal with spread. But there was no policy to force COVID-19 positive patients in homes, something that seems to be re-adjudicated in this chamber every day, multiple times. But Michigan and I'm quoting again, Michigan did do in the spring of 2020 was create a system of hubs comprised of nursing homes that volunteered, I say again, volunteered to take COVID-19 patients from other facilities who could not properly isolate them, or patients leaving hospitals that needed a nursing home to go to. Those facilities were required to have total physical separation between the COVID and non-COVID patients and have separate staffs. That does not sound like the policy that we saw in New York. It does not sound like the policy that you've seen in some of the other places, because in Michigan, no one was forced to take COVID-19 positive patients. And certainly, no one was even encouraged to take them that could not handle and do it safely. But things were moving fast. I'm sure people were not doing everything that we now know they should have been. And so what we should be doing now is saying, how do we prepare them for the next moment, for the next day? Because we are still not out of this situation. Melissa Samuel, the president and CEO of HCAM, said, there's this theory that somehow Michigan did it differently, that we're weird. But in fact, most states did the same thing as Michigan in isolating COVID patients from non-COVID patients in the same facilities. Again, no investigation. The people who run the thing were saying, we did what most people did, which was the best that we could, which obviously was not good enough. So let's fix it going forward. Even going further, in front of the US Senate, Tamara Konzinski, a University of Chicago expert in geriatric public health who testified before the US Senate committee looking into COVID deaths in nursing homes, said, I have seen no evidence, no good evidence, that those policies that Michigan had changed anything or had any effect on COVID-19 outcomes in nursing homes. So again, why do we constantly keep going back except for political points? Because all the experts say, there's nothing there. The prosecutors say, there's no good evidence. And people are looking. She goes on to say, if you look at the nursing home deaths per nursing home residents, the highest states are equally divided between Republican states and Democratic states. This is not a political issue. This is an issue that we lost too many people we care about. This is the issue that we lost too many people that we love, and we haven't spent enough time trying to make sure that that number is less. The states that had this policy about hospital admissions don't pop out in any way. And that's a direct quote. They don't pop out in any way. We all know that COVID spread has been the #1 issue, and I think the author sums it up quite clearly. It's a point made by others in focusing on the discarded policy from last spring. Republicans are discounting the major factor driving the numbers, which is community spread of the virus. Even a casual look at the pattern of nursing home outbreaks shows nursing home cases and deaths go up as transmission rates of the virus increase in the surrounding community. That's a direct quote. We know that this is about stopping the spread in communities, and that stops the spread in nursing homes. Again, quoting, those nursing home case and death trends are almost indistinguishable from virus prevalence in the surrounding community. Again, if you want to protect residents in nursing homes, protect residents outside. For months, the refrain has been from this chamber, show us the data. Here is what the data says, and I'm quoting, Michigan is below the national average in percentage of coronavirus deaths attributed to skilled nursing facilities, based on data collected by the U.S. Centers for Medicare and Medicaid Services. In Michigan, 23% of all coronavirus deaths involved residents of facilities reporting to CMS nationally. It's 27%. So Michigan is doing 4% better. Again, not great, but not worse. Michigan is below the national average in coronavirus deaths per 1,000 nursing homes, resident CMS data shows. Michigan is slightly below average in percentage of people age 75 and older who have died of coronavirus, regardless of whether they lived in a long-term care facility since the start of the pandemic. 1.3% of Americans age 75 and older have died of coronavirus compared to 1.2% of Michiganders in that age group. There's no smoking gun. There is no data that suggests that all this thing is going wrong. And Robin Rontel, a policy analyst, director at U of M's CHART, led independent analysis of Michigan's handling of coronavirus in nursing homes. That project involved, as she'd say, many hours of going through the data and working with state staff to access the data, because it's available. And she says, we actually had lots of data to look at. And the publicly available data was really comprehensive. That does not sound like, can't find the data, it's hidden. It just sounds like professional researchers are good at finding data. Yes, they are. Like, have you ever gone to the library and not been able to find something, and you ask the librarian and the librarian knows exactly where it is because that's their job, they're a professional? Well, we have professional researchers. We have professionals who investigate these things, and they charge way less than attorneys. And they come back with not just what happened, but with solutions to go forward. And Michigan has incredible resources. We have one of the best public health schools in the country, in the world. And what they are doing is trying to find solutions on how we change our policy to protect more people. We should spend our dollars with researchers looking for answers that can be turned into policy, not wasting our dollars on prosecutors who can only go back and say, well, we investigated and no crimes were committed because we didn't have good evidence, because there's no reason to start an investigation because, exactly, there's no basis for an investigation. There's been no call for an investigation from any legitimate prosecutor based on evidence, which is what all good prosecutions rely on, evidence. Now, what there have been is a number of people who say, hey, what happened is unacceptable. And I'd be the first among them. It was unacceptable. And the way we solve that is by having better planning and better policies for the future. And so, colleagues, I'd ask that we don't spend money offering grants or bribes to local prosecutors to waste time and resources that should be spent on better things, and instead send those dollars to universities, to researchers who already don't have enough funding to do the incredibly valuable work that is necessary to answer the questions of how you stop the spread, how you protect our most vulnerable residents, but most importantly, how we better prepare for what will undoubtedly be another time that we have to deal with this challenge. Mr. President, I'd ask that my remarks be printed in the journal.